Assalamualaikum warahmatullahi wabarakatuh and very good day to everyone. I am Muhammad Zulfiqah from Neuron UITM. I will be presenting my research work entitled Effect of Tocotrienol Rich Fraction on Retinal Angiogenesis Transcription Factor in Diabetic Retinopathy Rodent Model. Diabetes mellitus is a non-communicable disease that has been affected to more than 400 million adult patients and will continue to rise. It can be categorized into type 1 and type 2 diabetes mellitus. Complications of diabetes can be divided into macrovascular and microvascular complication. Diabetic retinopathy, which I will refer as DR, is the second leading microvascular complication. Globally, 35% of diabetes patients develop DR and around 10% of them have vision-threatening problems. Similar incident is also occur in Malaysia. Biochemical abnormalities secondary to chronic hyperglycemia lead to DR formation. From this event, it can cause impaired vision and even blindness. Oxidative stress happens when there is imbalance between pro and antioxidant. In chronic hyperglycemia, OS is triggered by increased stimulation of polyol, AGE products, and PKC pathway. So, how are these pathways can cross-link with angiogenesis, which is the focus of this study, specifically in DR pathogenesis. This pathway will stimulate transcription factor HIF1 alpha, which lead to the expression of the target biomarkers responsible for angiogenesis. This is one of the most important mechanisms in DR pathogenesis. SDR treatments are usually given at later stage of the disease and focus are given at the end point complication of DR, so it is therefore important for researchers to explore new alternatives. In this study, we explore the possibility of using tocotrienol rich fraction or known as TRF. TRF that we are using is an extract of palm oil which consists of 25% of alpha tocopherol and 75% tocotrienol. As compared to its sister analog, the tocotrienol possesses superior antioxidant because of the presence of 3 double bonds in the isoprenoid chain which allow better penetration into the cells. It is known to have anti-angiogenic, the most important mechanism for its protective effect against DR disease. In this study, the objective is to evaluate the retinal venous and atrial diameter by indirect ophthalmoscope, retinal angiogenesis marker VEGF and IGF-1 by using ELISA, and last but not least, HIF-1 alpha by using similar method. Moving on to the result, for body weight gain, NRAT showed the constant increase throughout the treatment period. However, DV-RAT showed slower weight gain compared to N, which could be due to the impaired metabolic activity. Interestingly, DT revealed a significant increment of body weight gain from week 9 until week 12. For blood glucose, NRAT showed around 7 to 9 millimole per liter, whereas diabetic rats showed a constant high level of glucose. DT showed small but significant lowering as early as week 4. This could be due to the improvement on the uptake of glucose by body cells, which was like what has been reported previously. Next, the image of the retinal vein and artery were captured using indirect ophthalmoscope. The image was then processed with VG imager software for quantitative assessment. There was an increment in the venous diameter of DV at week 6 and 12. However, reduction was significantly observed in the DT. For arterial diameter, however, there was no changes between the three groups. The improvement in the venous diameter might be associated with the improvement in the retinal angiogenesis. We have seen that the retinal VEGF protein expression is reduced in DT. Another angiogenic marker, IGF-1, which has been reported to induce VEGF and HIF-1 alpha expression, also showed similar trend. HIF-1 alpha is an important transcription factor that promotes VEGF expression. Similar findings were again observed in this marker by using similar method. The anti-angiogenic properties of TRF has been attributed in previous studies due to its ability to suppress RAS, RAF, MERK, ERK, and FIN HIF-1 alpha signaling pathways. In conclusion, the mechanism responsible for the protective effect of TRF in ascites-induced DR rats was due to its ability to reduce angiogenesis at 100 mg per kg dose for 12 weeks of supplementation, which is further evidenced by improvement in the retinal venous diameter. Several other molecular pathways involved in DR pathogenesis that beyond the scope of this study can be covered in future for deeper understanding. These are our previously published manuscript in Biomolecules, Neuroscience Research Notes, and Asian Journal of Medicine and Biomedicine. I would like to extend my gratitude to all investigators, sponsors, and research institutes for their kind contribution to this study. These are my references for this presentation. And so much of thanks for paying attention.